My name is Christina Tsirigoti. I'm a third-year virology student in the University of Glasgow, and today we're going to be talking about how multiple sclerosis can be treated with HIV drug treatment. Lately, BBC News posted the case of a multiple sclerosis patient, Sena Pesaro, who thought that she might have contracted HIV. So her doctor administered a 28-day treatment of HIV antiretrovirals, and here is what happened.
Sofa, like that. That's not normal. I can't normally stand up like that on the sofa. And look, I can walk really quite quickly and easily with crutches. Again, this is not normal. Yeah. I can turn around corners without falling over. And trip over things, yeah. Trip over things. I'm still capable of doing that.
You know, so if I can play the piano today and move my hands and coordinate them,
Okay.
it's such a massive change I can't even begin to tell you.
Do we all understand what's going on here? Like, this patient used to have multiple sclerosis for all of these years, and finally she can walk. She can coordinate her hands and play the piano for the first time, only during those 28 days of this treatment. After that, of course, the symptoms reoccurred. She couldn't walk anymore. So here comes the question. We start thinking and wonder, are they related, AIDS and multiple sclerosis? Let's understand first what multiple sclerosis is, because most of us might have heard it, might be familiar with the term, but might not know a lot of detail. Scientifically, we can say that multiple sclerosis is an inflammatory disease where damage of fatty myelin sheaths around the action of the CNS, the central nervous system, in the brain and the spinal cord is happening. But in plain English, we can say that multiple sclerosis is an autoimmune disease. Do we have any Harry Potter fans here? Good. This makes things easier for you to understand that myelin is like Snape. Because Snape, as we all know, was a good guy, but Harry Potter, who represents our body, couldn't see that. So during the books, he thought that Snape is a bad guy, so he started fighting against him. But in the end, what he actually did was fighting against himself. And now you basically understood the concept of autoimmunity in multiple sclerosis. There are several symptoms of multiple sclerosis apart from walking difficulty that most of us know, like numbness, fatigue, and other neglected things like depression, emotional changes, even sexual dysfunction. But there are different types of multiple sclerosis. The one that we all know, the most common one, is the one that comes and goes unpredictably. It's called relapsing remitting multiple sclerosis. The cause of multiple sclerosis is not known for sure, but there are some theories, including virus infection, genetics, and environmental factors, such as smoking and lack of vitamin D. But because I'm studying virology, we will be focusing only on virus infection. What are these viruses that are linked to multiple sclerosis? They are called HERVs, stands for human endogenous retroviruses, and they are a subcategory of retroviruses. These viruses are the Epstein-Barr virus, human herpes virus type 6, and MS-associated virus, but we're not going to be focusing on those, because what we want to focus on today is another retrovirus, the HIV virus. Do you see the connection between those? This connection is the key today. And let's understand what HIV does. We all know that it causes AIDS, stands for acquired immunodeficiency syndrome. But what we don't know is if someone can have AIDS and multiple sclerosis at the same time, if someone can be like Sena. What is the AIDS then? Let's understand that first. What happens is that HIV targets our immune system firstly, and HIV does that by targeting are most important cells of our adaptive immunity called T helper cells. During that process, many T helper cells die till we have very, very low levels of those. And when this happens, our immune system is not able to defend itself anymore. So we are very vulnerable to any infection, and this basically means that we can die from any kind of infection, like the common cold. However, the same abnormality in the same kind of cells, the T helper cells, is also shown in patients who have multiple sclerosis. So there's another linkage here that makes us think that maybe these two diseases are related. How was this linkage tested? We take this case of Seina again, and there are two scenarios of how she finally walked. The first hypothesis says that the HIV drugs that she was given could prevent multiple sclerosis, and if we can prove that, we will know for sure that HIV can prevent or treat the development of multiple sclerosis. Another hypothesis, which is very similar to the first one, says that this antiretroviral treatment that was supposed to suppress the HIV replication in Seina, what actually did was to suppress other viruses, the HERVs. HERVs are the viruses that we said before, the ones that are meant to cause multiple sclerosis. So if this is true, we will have we have treated accidentally multiple sclerosis with these drugs. What is that treatment? Seina was given highly active antiretroviral therapy. It's called HART. This is the treatment that all HIV patients are given. But every patient is given a different combination of drugs. These are the drugs, for your knowledge. And what they actually do is that they're targeting the HIV viral load. They're trying to decrease it. And at the same time, the T helper cells start increasing again. So when these cells that we said before start increasing, what is happening is that our immune system starts working again, so we're not that vulnerable anymore. All of these results led to the creation of a clinical trial called INSPIRE. INSPIRE's goal is to treat multiple sclerosis patients who do not necessarily have HIV infection. The INSPIRE trial is studying many HIV drugs, but more specifically the HIV drug called raltegravir. And till now we know that raltegravir does not allow multiple sclerosis to progress in relapsing remitting patients. So if we pause here and we think what I just told you, can we finally celebrate and say, yeah, we found the treatment of HIV, of multiple sclerosis with HIV antiretrovirals? No, but I would say not yet, because there are some limitations, such as the fact that many pharmaceutical companies do not produce therapies for multiple sclerosis. They produce therapies for AIDS, but none of those have any regulations about what we should do in case of a patient that has both. And of course, they don't produce any drugs for both diseases. So we started thinking, do we have all of the correct material all these years? Can it be only Seina or a few other people in the world that have both? Or is it just because there was wrong diagnosis all this year? In 1980s was the decade that HIV was firstly discovered, and only a decade after that, the first antiretroviral treatment was initiated. So in the 90s, maybe the diagnosis process was not that common. So we have to face with the wrong diagnosis problem, where there might have been many patients who had both multiple sclerosis and HIV infection, but maybe they were classified as either MS or HIV patients. And this makes diagnosis difficult for doctors, but we cannot always say that doctors are to blame. They might have no clue. But there are some good news. We can say that all of these things that we have gathered will lead us to the future of the treatment of multiple sclerosis. For example, we have to wait for the raltegravir results. When they are published, we will know for sure if we can use HIV antiretrovirals to treat multiple sclerosis. But till then, we can do other things. There are some suggestions that say that we can improve the diagnosis process with the help not only of neurologists, but also the help of biologists. For example, they can start performing PCR, which is a very common biological laboratory technique in MS brain biopsies, or they can do some brain imaging, like MRI in brain lesions of multiple sclerosis patients, where we can see the development of the white matter as the disease progresses. And finally, if we know the exact number of those helper cells that I mentioned so many times today, and we improve the techniques to count them, we will know for sure what is going on there. We will start creating a new database, we will have the correct material, and then future studies will be focused on those materials. And we will know if there are more people like Sena in the world. So in this way, we will finally treat this disease, multiple sclerosis, a disease that affects more than 2 million people in the world. Thank you.
So I think what I'm quite interested in just now is sort of it seems like a bit of a controversial or sort of a slightly difficult area to research in terms of actually practically undertaking studies. Is that sort of been your experience, or has it been sort of, is that an area that sort of there's a lot of research undergoing currently?
I'm a third-year student, so this is not my final project. So this is a research that we did for the sake of university. In the first semester, we had to find a BBC article that is describing something like a virus, because I'm doing virology. If you're doing microbiology, theme. And then I started doing this research. After the essay, this was why I had to research that, I took this topic and I tried to research more about that. So it's not a current research going on in the university.
Yeah. Do you think that it should be a research priority then? Would you say sort of if you're hypothetically going to do a PhD, would you is this an area that you might be interested in, or hypothetically someone should be sort of chasing up?
I think it's very interesting and might have a lot of impact in the world, and they should start giving more positions to students to have a PhD on this field. Or maybe they can recruit more people to take part in these clinical trials so that we will start collecting the correct material that I said. And also, till then, maybe the results of Raltegravir will be published, and we will know whether more positions will be open.
Do you know of any downsides to using the drug treatment for MS, or possible maybe dangers about that?
I don't think that there are any side effects, but we have to wait for the clinical trials, of course. Yeah.
I was wondering if there are any statistics that you're aware of. So which countries may have a higher sort of level of MS, or if that's related at all to what you do?
There are some facts that might create a third hypothesis that say that people who already have HIV infection might not progress multiple sclerosis, and we can understand that by looking at the multiple sclerosis map in the world, where we can see that in sub-Saharan Africa, for example, where we all know that there are many cases of HIV infections, the multiple sclerosis cases are very low, like one of the lowest in the world. So this makes us think that there must be another correlation there.
Cool.
Do you know what stage the clinical trials are at?
I know that the latest paper that gathered everything together was last year. So since they haven't published anything else this year, maybe they are about to release it. I don't know. I hope they're in a good level. Okay.
Okay. Again, so thank you very much.